Now, government has often cited Rwanda as a successful test case for the implementation of the drone delivery of essential medication and blood to rural areas. This is because the company behind the innovation Zipline implemented the project first in Rwanda, where supply of medication to some areas has been reduced from 5 hours to 30 minutes. As Ghana prepares to roll out the $12.5 million project, JoyNews' Matilda Pomega joined the team of journalists who were given a guided tour of the drone program in Rwanda.
At the Ruhango Provincial Hospital in Rwanda, doctors and nurses are now used to the fact that they can collect blood packages dropped by drones from the sky and go ahead to transfuse their patients who often need it on emergency. Before this hospital was signed onto the Zipline drone service, it typically took 4 to 5 hours of a round trip to secure blood from the capital Kigali for patients. The delays often results in loss of lives. Dr. Richard Osai is Director General of the Ruhango Provincial Hospital.
We were supposed to use 4 to 5 hours round trip to get blood. From here to Kigali parking, round trip could take us 5 hours. So financially it was cost because there is a matter of fuel for that car, time consuming, and thirdly, if you have emergency, we couldn't save that person having round trip to get blood replacement. Even if we could be having blood bank in our hospital, but you had some maximum limit of unit to be stored in your blood bank of the hospital.
This is the Zipline Center in Muwanga, Rwanda, where emergency medical supplies are sent to health facilities around this community. We are told that 21 district facilities alone receive daily supplies from here.
With an average of 40 deliveries per day within an 80-kilometer radius, the Zipline Center receives regular blood supplies from the National Center for Blood Transfusion from Kigali to hospitals who are in need of blood. The government of Rwanda has signed 21 hospitals onto the Zipline platform. This is how the process begins.
Emergency orders as well as resupply orders. So emergency order is when a patient is in dire need of a blood product, and the patient is dying and the hospital has called for us to supply. And then a resupply order is when the hospital is running low on their stock and they need to replenish their stocks. So basically, we do those two orders, emergency orders and resupply orders. So you take the doctor's details and then the doctor's number as well. If it's a resupply order or the hospital is just trying to restock, he's going to ask for their current stock because we just want to know how many products you have in stock and why you are ordering so that you don't overstock. I think that could be an order that is coming in right now. So he's going to receive the order, take the details and then process it. He is going to do the packaging. So the system is such that as soon as he's done processing the order, he moves on to the next screen, and then the gentleman over there packs. So I'll take you to the packing side as well. So everything we do at the packaging side has been really calculated, considering the weight of the products. Everything has been calculated. So after packing, we have the boxes that we use to do the packing. So this is a proprietary Zipline box. No company uses this kind of box. And I'm sure you saw the ladies preparing the parachute at the end there. So the parachute is supposed to help the box sort of land in a very perfect fashion so that the box doesn't go to another point. So even before we start operations at a particular hospital, we go to prepare or select a drop zone where the product is going to land. Now, you can see clearly that the box has some rubber material in there. I can pass it around for everybody to have a feel of it. It's supposed to absorb shock so that when it lands, it's going to create a bounce so that it doesn't damage the blood product or anything. So we put the products wrapped in a dunnage. This dunnage is also supposed to help maintain temperature and also help with the bounce. So it is wrapped in the dunnage and then it is inserted here. And then we can also see that every package has an ID on it, and that package ID is linked to a particular drone, and it's also linked to a particular product. So once the product is launched, we know which exact drone is carrying which particular product and in which particular box, so we can always track the process as it goes along.
Medical doctors at Rwanda say using drones in the delivery of blood is yielding results in health facilities in the remotest parts of the country.
Patient satisfaction, they are seeing drones that first, and they know that those drones are not filming, are not doing anything else. They are here to save their life. They are here to deliver blood. So they are safe. They know that anytime there may be a case of bleeding or need of blood, not only bleeding on surgery, even any anemia secondary to any pathologic condition. In few words, they are safe. They know that anytime they need blood, we will use drone and blood will be delivered to them.
For these medical experts, drone delivery means hospitals can also store less blood, which means less waste as blood spoils quickly. After 2 years of operation in the country's southern and western provinces, the use of drones to deliver blood and other medical supplies will be expanded to the eastern province of Rwanda in the coming days. In Ghana, the 12.5 million medical drone contract has been the center of controversy in the last few months. But there may be some lessons to learn from the Rwandan experience. For JoyNews, Matilda Humaga, Muhango, Rwanda.